Welcome to today's webinar on supporting engagement. We've got quite a lot of content to cover today. And on the back of that, I've got a few colleagues that I'd like to welcome from Scottish Government who will be introducing themselves just shortly. We've got Professor Craig White, we've got Louise White, and we've got Donna McLeod from Scottish Government. They'll be talking through the main topic area, which is the developing of national guidance for engagement today. And myself and my colleague Emma Ashman will be talking through some areas of development which support that work, which is around the development of a quality framework for community engagement. So I hope you find this content useful and interesting. What we hope to do is just gather any kind of chat through the chat box today. So please feel free to talk as we speak through this. What we'll be doing is there's an override on your cameras and mics just while we're presenting on that. But that will be freed up at the end for the question and answers. So please just feel free at the end. We'll take some time for questions and answers. If there's anything, put your hands up or put it into the chat box, and we'll try and get round all the comments. So I've got a few colleagues supporting us today, so you might see some other people coming in and out from that. So really, without any kind of further ado, a few other kind of points to pick up. As I said, we've got a lot of people on the call, roughly around about 120, I think, on today's call, which is great to see, really good. The call is also being recorded. So that is so that we can actually see that again if anybody wants to look at that at a later date at all. So please, if there's any kind of comments or thoughts that you've got and questions, please feel free to share anything that you want. So without further ado, I'll get started. I'll pass you across to my Scottish Government colleagues to give you some details around the guidance and the development of guidance. So I see Professor Craig White has come on. I'll pass across to Craig.
Thanks very much, Daniel. Hi, everyone. I'm just going to check. I notice a few things in the chat of colleagues saying that they've had sound issues, so I'm sure colleagues at his have spotted that. So just wanted to acknowledge that in case there's anything that needs to be done to support colleagues who are having sound difficulties. Thanks, as I said, Daniel and colleagues at his for arranging this event today. My name's Craig White. I work as Deputy Director at the Scottish Government, and I had the pleasure of co-chairing the Community Engagement Guidance Working Group that worked over the course of about a year and a half to develop the Planning with People community engagement and participation guidance, which you're all aware of. Nicola Dickey, the Chief Officer for Health and Social Care at COSLA, was my co-chair, and prior to that, John Wood, who was Chief Officer before Nicola took up post. We were very privileged to have a number of skilled and wise colleagues who have expertise and work in this area, working with us during the time that the group was meeting. Nicola and I wrote in March, just after the guidance was published, to all NHS board chief execs, the IJB chief officers and local authority chief executives to alert them to the publication of the guidance. Many of you on the call will be aware of the content of that document. It set out the principles and expectations in relation to community engagement, and very much signalled this as the beginning of a process in looking at how to best support work in this area, how to support improvements, how to create networks and identify ways of connecting colleagues across organisations and across the country in terms of any learning and support that might be required. During the time that the working group was working on this, the Independent Review of Adult Social Care was doing its work, and shortly before this guidance was published, that review was published, and as many of you on the call I know will be aware, the importance of ensuring that the voices of people who require and use services, carers and the public being involved shaping and developing future health and social care services was a central element of the Feely review, the independent review of adult social care. The guidance document was very much around what, and intentionally not so much around the how. A number of reasons for that. There's such a diversity of organisations, sectors and communities. What we wanted to do was make sure that we worked in collaboration with you and your colleagues around what might be required in order to take this from the what to the how, as I said, in a way that's informed by expertise, by knowledge, what's worked well, and connecting with one another in a way that addressed and harnessed and developed implementation support for this over the course of the next year or so. So I'm grateful to you for taking part today. I noticed in the chat somebody saying nice to see me. It was nice to see names of colleagues across the system that I've worked with previously. I'm really looking forward to the event. I'm going to ask Donna, my colleague in Scottish Government, to talk to you next in terms of the journey that I've just mentioned and the process that has got us to this point today. And as if by magic, Donna has appeared superimposed over Edinburgh, and over to you, Donna.
Thanks, Craig, for setting the scene for us today and for playing such an active part in the production of the guidance alongside Nicola. As Craig mentioned, Planning with People is a co-owned document between Scottish Government and COSLA, and it's been produced in partnership with Healthcare Improvement Scotland and the Care Inspectorate. Although it's not a legally binding document, the guidance supports organisations to deliver their existing statutory duties for engagement and public involvement. The guidance applies to all care services, including those for children, young people and adults. It should be followed not only by health and social care providers, but also by local, regional and national planners, special boards and all independent contractors and suppliers such as care homes, pharmacies and general practices. In other words, community engagement is an important process that we should all be placing at the top of our priorities. And before we move on, let's just remind ourselves what we mean by community engagement. Can I have the first slide, please? So, what is community engagement? As you'll all be aware, community refers to a group of people who share a common place, a common interest and a common identity. There are also individuals and groups with common needs. It's important to recognise that communities are diverse and that people can belong to several at one time. Engagement covers a range of activities that encourage and enable people to be involved in the decisions that affect them. This can range from encouraging communities to share their views on how their needs are best met and influence how services should be delivered, to giving communities the power to inform decisions and even provide services. Co-production is key to successful community engagement, and it's been described as the process of active dialogue and engagement between people who use services and those who provide them. So, Planning with People represents a new way of doing things. It promotes consistency, culture change and true collaboration, and it encourages creativity, innovation, and that would be all based in best practice. Planning with People sets out how members of the public can expect to be engaged by NHS boards, integration joint boards and local authorities. We want to recognise all the good work that's taken place, and the guidance is designed to complement and strengthen organisations' existing engagement strategies. It also encourages close working between bodies to minimise duplication and share learning. Can I have the next slide, please? So, purpose of the guidance. The guidance is not a step-by-step guide to community engagement, but what it does aim to do is to improve a general understanding of what effective community engagement means in relation to the development of care services. The purpose of the guidance is to support greater collaboration between those making decisions about care services in Scotland, those delivering services and people in communities who are affected. Regardless of where you're positioned, we would encourage all of you to learn more about community engagement. Planning with People should be used by people who are experienced in engagement and also for those who are new in the field. Planning with People is available online at Scottish Government website and COSLA websites, and we hope that you'll take the time to download and read through it, because it contains a feast of information and so many helpful resources. And remember, it's guidance, it's not a manual, it's guidance. We would also appreciate if we could hear from you about all matters community engagement. I'm going to introduce Louise White, who is about to embark upon a piece of work involving significant consultation, which we would like you all to be part of. In the meantime, thank you very much for your time this afternoon, and I will hand over now to Louise.
Donna, thank you very much indeed. It's good to engage with all of you this afternoon. Like Donna, I work for Scottish Government, and we are a participation team who look after community engagement, volunteering within the NHS, spiritual care and chaplaincy, amongst other policy areas. Community engagement is a significant part of our work, and developing the guidance is very much at the forefront of the work that we are undertaking. Now, the clue is in the title, of course. It's called Community Engagement, Planning with People. I hope you're actually seeing this at the moment. I don't know whether I've got problems with my camera, but I'm just going to keep on going. So on a very basic level, communication is at the heart of who we are as human beings. We connect and interact, exchange information and ideas, all of which are made possible through communication. Our relationships are built and maintained through communication. Our education and work depend on communication, and our participation in justice systems, political and civic life are all negotiated through it. Scotland's national and local governments are, of course, committed to improving the ways individual people and groups of people can be involved in decision making that affects them. And this is what we're talking about today: community engagement, a two-way communication process between decision makers and our rich and diverse communities, with the aim of building trust, understanding and learning. And nowhere is communication more vital than when it comes to the development of the health and social care services that we use every single day. The days of health and social care operating in isolation are gone. Now people expect their care providers to collaborate to develop seamless care. And that demands a joint commitment to working in partnership with people themselves to co-create services that suit everyone. Listening to the views of people who use services and actively involving them throughout the process of planning care delivery is, of course, a key component of the recommendation of the independent review of adult social care in Scotland that Craig referred to just a few moments ago. So what is good community engagement? What does it look like? And how do we know when we are doing it well? Well, in terms of our draft guidance, this is what we aim to establish within the next 12 months. By reaching out to health boards, local authorities, the third sector, as well as a wide range of organisations, we hope to identify what we mean by good engagement, what turns a box-ticking exercise into a meaningful and impactful interaction. For me, it's about the difference between hearing and listening, placing yourself in the shoes of the person who is taking the time to explain their hopes or fears. It's not about involving the usual suspects, the voices that will tell you what you want to hear. It's about having the courage to really reach out to the people who feel they are never listened to. All decision makers have a responsibility to open up lines of communication, to listen and engage, and only then can informed decisions be reached. In terms of the guidance and what we are capturing, the lived experience will be at its heart. We want to produce a document and supporting tools that will be illustrated by real life examples. If you've been involved in community engagement, then we want to hear from you. Tell us about it. How did you find the process? How did you go about it? And what was the outcome? As we listen to a wide range of voices during the coming months, we want to bring this guidance to life. Tell us your stories. How are you having to adapt and change your methods of engagement? For example, by introducing digital engagement, interact the limitations on face-to-face meetings and events during the pandemic. Regardless of whether you're a service provider, decision maker, or a service user, or indeed a real person, help us to help you succeed with engagement. As we research, refine and update planning with people, Don't forget, there is a wealth of information within the draft guidance, which we would encourage you to use. Healthcare Improvement Scotland has loads of information available online, offering advice and resources, as well as a range of engagement methods, tools and guides to best practice. More importantly, Healthcare Improvement Scotland and the Care Inspectorate are also working on a key piece of work to complement the written guidance, which we will share with you in just a moment. To get in touch with all your comments and feedback, please email us at cedocumentfeedback@gov.scot. We'll put that address in the chat box. It's been a pleasure speaking to you today, and I really do hope that we will have the opportunity to speak again. And now, to hear more about the quality framework, I would like to hand over to Daniel and Emma at Healthcare Improvement Scotland.
Thanks very much, Louise. And quite a few kind of thought-provoking comments there, Louise, from yourself, and it's created a bit of chatter in the chat box as well. One of the things that I'd be keen to support is the position that you're wanting to use the coming months to really engage on the guidance that's been published. I think that's one of the kind of important things with this, and also with the quality framework, that we're really keen that these things aren't set in stone, that we're looking to listen and we're looking to develop these as we move forward to make sure that they fit for everyone. So in terms of the quality framework itself, if I could just get the slides on this, please, if possible. And really, I suppose Craig had mentioned that the guidance was about the what in terms of good community engagement. What we're trying to do with the quality framework is provide a bit more of the how, some of the kind of practical steps with this. I'll spend the next 10-15 minutes or so talking through the work that we've developed on this alongside the Care Inspectorate. And my colleague Emma will come in and talk through some of the more kind of practical here and now points that we've got at this moment in time, just to really bring you up to speed with the developments of this. Probably important to say, this, as I said, developed in collaboration with the Care Inspectorate, was really running alongside the development of guidance, and what ourselves and the Care Inspectorate were seeking to do were to try and understand how we can support organisations alongside our statutory duties. The statutory duties we have are to drive improvement across health and social care services, but for ourselves at Healthcare Improvement Scotland, we also have added statutory duties around public involvement. So those public involvement duties span health services across both NHS boards and health and social care partnerships. For us, we're very, very keen to develop systems and develop ways of working that suit everyone, that make sure that people's voices are heard, also to support practice. If I can just move on to the next slide, please. And really these fit together in quite a complementary way. The development of the quality framework was very much kind of originally based on the European Foundation for Quality Management. Now that was kind of drawn on to support organisations develop quality within their own systems. We've looked at that within Healthcare Improvement Scotland, and we started to develop different approaches and how we were going to use that. From our perspective around community engagement, we looked at developing the quality framework for community engagement and participation. Now, what we were keen to do with that was look to take the principles that were contained within the guidance document, and I see one of the comments in the chat box was around the national standards for community engagement, very much based on those. That's where the guidance was developed from, and also where we're kind of developing the quality framework for. And we were very keen to make sure that there was a read across between the two, and the organisations looking to support themselves through the quality framework would be able to support the guidance and the asks and the expectations of the guidance. But what we tried to do with this, and we looked to develop, was an approach that created, which was for some areas, or is for some areas, a new approach around self-evaluation. Now, the idea of self-evaluation here was to support the organisation in itself, create more self-awareness in terms of how it performs, but also to look to reflect on itself in terms of what it's doing well, areas for potential improvement, and what it could take forward in terms of actions for improvement. So really trying to create that platform very much as a starting point for an improvement journey for the organisation. If you can move on to the next slide, please. So really the key areas for us in terms of developing this framework, very, very keen to use the quality framework to really help organisations understand what good engagement looks like. Now that's for them as an organisation, it's for the decision makers for the organisation, and it's for them to actually understand what good practice looks like as well to support that good practice move forward. What we hope that it will do is create a platform and create a system for internal assurance by the organisation to create that self-evaluation and create self-awareness within the organisation. They'll then have a better understanding about what's working well and what could be improved within the organisation to support quality and support the work move forward. It should be used to identify areas for improvement. As I said, the self-evaluation step, very much the starting point of that journey, and it's really what happens after that self-evaluation that really matters for the organisation. What we're very keen to do is that self-evaluation sits alongside other data and intelligence and information about the organisation to create a more informed position in terms of what needs to be taken forward and what areas should be improved or could be improved. And really lastly, the point here, really want to support and assure engagement activity. Now that's supporting internal assurance, but it's also for ourselves in the Care Inspectorate to support any forms of external assurance as well. Now, for the guidance being published, we have a quality assurance role for major service change within NHS boards. That won't change, but we'll also be looking to deliver other forms of external assurance as well. So we want to use the quality framework to support that move forward. And finally, we really want to create a system that supports learning. Now, we want organisations to be able to share that. We want them to be sharing it across the country because we come across areas, situations, challenges where a lot of organisations are wrestling with the same things and trying the same things. So we're very much keen on when something's working well, then that's cascaded or shared across the country. Move on to the next slide, please. The way in which the quality framework has been developed, very much kind of three cornerstones for good community engagement. Now the triangle that you see in front of you probably has three areas of focus which we've developed into domains. Now the area at the top really looks at how an organisation would undertake its ongoing routine activity. So how does it deliver ongoing routine engagement on a day-to-day, week-to-week basis? It's really about how the organisation functions. You know, does it do it as a matter of course, or does it wait until it needs to do it and feels obliged to do it? So we're really wanting to try and develop and embed that way of working that's about just how they do things and move that forward. The bottom right area, looking at governance. So how does the organisation themselves support good community engagement? What capacity does the organisation have for doing that? Now, we know a lot of organisations are very challenged on that. And what we want to do is use this system to try and understand, are there capacity issues? Are there resource issues? You know, are there things that could be developed to support engagement activity move forward? So very keen to look at that, but also, how does the organisation support its governance around this? You know, how are decisions made? One of the key points within the guidance document is that, you know, community engagement should be used as part of the decision making and should be used to inform the decision making processes. So it's very important that the organisation can rely on that work as they move forward. And the final element of the three is around more start-stop areas of work. So we would tend to see those as things like service change activities and service redesign activities. So when an organisation identifies a need to do something, there becomes that planning stage for that. So they're very much looking at a planning stage right through to an implementation stage. So very much seeing a kind of start to end point for those periods of work. Now, these three domains that we've got, with the self-evaluation approach, and happy to move on to the next slide, if possible. With the self-evaluation approach, we've worked with a lot of colleagues and a lot of stakeholders and a lot of partners to understand what good looks like, but also to review all relevant policy and practice to form what we've got as a set of self-evaluation statements under those three areas. Now, those self-evaluation statements they're quite comprehensive in covering, the key areas of identifying good practice around some of the must-dos, around some of the statutory duties, but also some of the areas in terms of what should be delivered as matter of course and as part of the practice. We're very keen to use that self-evaluation as the starting point. What we hope to do with the process is that self-evaluation would be completed by a number of individuals from the organisation around all those statements. And that feedback would create what we've got here is a bit of a consensus session. It's really using that collated feedback to see, where's the organisation sitting and fitting, where's it doing well, where's the variance in that. So where do some people believe the organisation's doing well, where do other people believe that the organisation could be developing more in, and creating a bit of a discussion around about those areas within the organisation. As I said earlier, that material would be set alongside other information and other data. So looking at it as a whole, where does the organisation believe they should be looking to develop and move forward, but also where do they recognise their strengths within the work that they do? That very much tees up the next stages within this, which are around the improvement planning and the draft improvement plan. So for the organisation, what needs to happen next? Where are the areas for improvement that the organisation needs to take forward in moving this work forward, and who's best placed to do it? Now, if that's within the organisation themselves, then they want to identify the contacts, the leads for that work. But there's a whole host of organisations and support out with the organisation. So part of this is about who's best placed to support the organisation moving forward with that. And really the last piece here in a continuum is looking at what engagement activity needs to be taken forward over the rest of that period. So very much in a kind of whole, that looks at the journey of this work. Where we're currently at with this at this moment in time is that we have an advisory group to look to develop this work and move it forward. We also have a really good group of engagement practitioners from NHS boards and partnerships supporting us over the last few months to look at the content of our material and also look to provide advice to inform how this moves forward. Really keen to try and test this further over the coming months. It's not been without its challenges because of the pandemic. One of the key considerations and one of the key areas for us is really to test this out with NHS boards and partnerships, which we hope to be in a position to do so in the coming months. But given the capacity issues and given the challenges for those organisations at this moment in time, we've been holding off just now to try and do that, but we're hoping to be in a position to do that in the coming months. As we move forward with this, be very, very keen to share the materials widely. If you're interested in this work, if you're interested in the materials moving forward or having a say or any further information or any further chats, please get in touch with us. We'd be more than happy to talk through this in more detail with you or your organisation and to answer any questions on that. And as we move forward to the next slide, I'll pass you across to my colleague Emma Ashwin, who'll talk through the support and practice.
Hi. Yeah, it was just to highlight some of the things we've been working on in the background to think about our role in supporting practice, advising and thinking about the improvement journey that hopefully this framework will take people on. So internally, we've been having discussions about the tools and resources that some of you already may be familiar with on our website, the participation toolkit, some of the animations we've been developing as well. So we've been considering how that fits with the three domains in the framework, areas we already have and areas we can develop. So we've been having some really good conversations internally about that. We've also been considering the quality assurance approach that we have with the framework and with the new guidance, our role to support, ensure and monitor. And we've been thinking about how we'll develop this external quality assurance roles as we're having those discussions with the advisory group and engagement practitioners. So we're developing that alongside the process. and also thinking again about that improvement activity rule, what that looks like, and we'll develop that in collaboration with stakeholders. We've also been thinking, as Daniel mentioned, that this is a really good opportunity to identify what good engagement looks like. As some of you may be aware, obviously we have our webinars, we also are developing workshop case studies, and also considering the development of a network for engagement practitioners so they're able to share the good practice information and also able to think about how we share what's worked well and what maybe hasn't worked so well to improve the quality of engagement. We can move on to the next slide, please, Claire. Just to give a little bit of detail to what Daniel was saying, in terms of developing the framework externally, it's very much as with the guidance, we're looking to take a collaborative approach for this. As Daniel mentioned, we've got the advisory group, which has representatives from Scottish Government, from COSLA, the Care Inspectorate, Audit Scotland, and other partner organisations. We've been working with them and the engagement practitioners, so that's people that are carrying out engagement in boards and partnerships to develop the content of the draft framework. Also developing the self-evaluation tools and also looking at the process and cycle of engagement, so it's going to support them in their work. As Daniel mentioned, obviously there has been some challenges, but over the last 6 months, the Care Inspectorate and ourselves, we've been reviewing the existing tools, documents and policy and guidance, which a lot of you will be familiar with our subgroup, with engagement practitioners, and we've been able to develop a draft self-evaluation tool, which they're really helpfully giving us feedback on, so we can consider how people can use those statements and domains to best assess how their organisation is performing overall. The next stage for us is to continue to define the self-evaluation tool with that smaller group of engagement practitioners from boards and partnerships, and then to move on to testing the tool. As I say, we did take account of the current demands on colleagues and staff, but we do hope to test the tool with colleagues, testing the self-evaluation tool and also the process and cycle of engagement for ourselves as well. And hopefully that feedback will be really useful and can help us further refine the process. Just pass back to you, Daniel.
Thanks for that, Emma, and thanks for that summary. Really, that's the summary of the work that we've got in development. As I said, in terms of the quality framework for engagement, looking at that very much in terms of looking to get to a testing phase with some of that over the coming month or two. So as I said, very keen to hear any interested areas. I see some in the chat box, and would be really keen to pick some of that up. But what we've got now is a bit of space for question and answers, and happy to come to Vic if there's any kind of comments that you want to pick up, Vic, for anyone.
Hi, Daniel. Thanks for that. And yes, there are tons and tons of comments and questions. So I don't think we'll be able to cover them all, I'm afraid. And I think I can probably thank Craig White for spurring on the conversation. So that was really useful. I'll sort of take it from the top and work my way down. So first question has come from Kim Hartley-Keane. Have you engaged with anyone such as speech and language therapists on inclusive communication? I'm not too sure who's best to answer that.
I'll jump in and say, no, we haven't as yet, but we are mapping at the moment. And I think that's a really valid point, because I think it was myself that highlighted communication, the very basic art of communication and how we communicate. And of course, for people who may not communicate in what you would call the normal way, then absolutely we have got to engage. So please feel free to email us with any thoughts on who you think we should be speaking to, because clearly we want to make sure that we are on track and that we are doing as good a job as possible. So a very valid point, and thanks for raising that.
Craig, do you want to jump in at this point?
Yeah, thanks, Victoria, and thanks for the question. I completely agree with Louise's response, but I guess that question also triggers for me some of the risks associated with seeing this as a standalone piece of work. So, for example, in developing this guidance across Scottish Government and COSLA, the various groups and networks that exist were invited. So in Scottish Government, for example, our AHP professional policy colleagues who work with speech and language therapists would have been involved. But what we want to do in terms of within Scottish Government is make sure that this, as much as possible, is not seen as something standalone, but work with people across the government, so that in the work that they're doing in a whole range of other areas, they are enabled and empowered to think about how are we relating to, collaborating with and involving people in services. So it's very much that narrative around joining the system up with more of itself, as opposed to I think it was Louise used the phrase usual suspects. Yes, we want to engage with the people who are usually involved because it's their job, they're good at it, they understand the system, but we also want it to be a general theme across the system, and it reaches more people than otherwise the case. And if I just may take the privilege of just saying something, Margaret in the chat, I think, put up the challenge of doing a word cloud of the documentation. So as if by magic, I just did a word cloud, but unfortunately the restrictions on Teams don't allow me to share it in the chat, so we can circulate that afterwards. And if I just remind myself what's on it, fortunately people was coming up a lot, engagement, decisions. So, but Margaret set the challenge, so I took up the challenge. The word cloud's done, and I'm sorry I can't share it.
That's great. Thank you ever so much, Craig. Now, I noticed we had a few hands up, but now I can't seem to see them. Elizabeth Forsyth, are you wanting to come in at this point?
Hi, everybody.
Hi there. We can see and hear you now, Elizabeth.
Okay. Hi. I'm the Strategic Plan Programme Manager in Dumfries and Galloway. I'm just wondering, or I'm just offering my experience recently when we've been developing a strategic commissioning plan. I've been working with a local group of people who have additional support needs, mainly people with learning disabilities or cognitive impairment. And we've been working closely with them. His have actually asked me to do a case study, which I will submit. But it's just remembering that, particularly in regards of health and social care, people with all sorts of needs have lived experience that they can share with us, and it might not be in the normal parameters of consultation, but their voices are no less important and no less valid. They've given me a tremendous amount of support in creating the easy read document version of our strategic commissioning plan, and it's just to say that we've made sure that engagement and consultation was proper engagement and consultation. It wasn't a tick box exercise to say, oh right, they're a protected characteristic group, let's get them done. Those people really helped co-develop and co-produce that document, and we hope that will encourage more people to engage, whether they have a learning disability, cognitive impairment, or just find strategic documents really difficult to read. And we've done that. We've done the paper copy, we've done it electronically, and we've done a BSL sign language video, and one of our volunteers with a learning disability is voicing that, doing the audio for us. So we are trying to make sure that people recognise themselves in that as well. So it's not about things being done to them, it's about including them in that as proper engagement.
That's fantastic to hear, Elizabeth. Thank you ever so much. And that's a very neat segue onto sort of the next question, actually. Louise Wheeler asked, I wonder, are there any plans to develop a more common language or understanding across health and social care, especially in terms of engagement?
So Donna's hands up, but maybe I'll just say part of this is that we want to capture these questions, but we also want you to be empowered to come up with the answers and actually say what you think needs to happen. That if we're going to get the bold and transformational change that's required to put people at the centre, and some of those barriers, be they language or different organisations, people like us who are taking the time today to connect around this, we want to, over the next year and the work that Donna, Louise and their colleagues are going to be doing, we want to empower and connect people to do that and to make some of these changes. And we're always happy to field questions, but sometimes I've got a concern that reinforces a narrative, and I know why it happens, that it will be up to the government, or the government will issue something, or his will say this is how you do it. We need to shift away from that. And I'm conscious of not reinforcing a narrative that suggests the solution for the future is having somebody pronounce how it should be.
Thanks, Craig. Donna, did you want to come in there, or?
Yep, just come in on the communication topic. I think in terms of offering background out, I think the guidance itself, there was so many different versions to the one that we have now. And one of the reasons that we had to work on that was because of it was making sure that it was universal in the way that it communicated engagement guidance. I think the point I'm trying to make is it was about we all talk in different cultures. So hope that makes sense. So clinical staff will speak in a particular way, researchers will speak in a particular way. We're not aware of it, but actually we all use different words, we use different, so the guidance was written, and it had to be totally overhauled, and we brought in Penny Taylor. I'm not sure if Penny's on the call, but Penny brought in a universal language that was very jargon light, and that was a big piece of the work we had to do. It was to make sure that it was jargon light, easy to understand, and we put a lot of work in making sure that the language within the guidance was universally accessible for those who were requiring to do it in the day-to-day as part of their job. So if there are areas we feel we still need to work upon, again, today's session will be the opportunity to come forward and let us know how we can do that. Thank you.
Thanks, Donna. Daniel, did you want to come in on the back of that?
It was really just to pick up that a lot of the kind of feedback I think that Scottish Government and COSLA probably received on the guidance probably highlighted the different wordings, different definitions, etc. We're picking a lot of that up with the quality framework as well. So I suppose the more we move forward with some of this, the more we actually get the common language as well, because it's not just simply a case of actually receiving that feedback, it's actually having the kind of two-way discussion to try and bring everybody together, I think, and try and create that kind of cohesive language, I think, as we move forward. So the more we do of that, the better, as opposed to people staying in their silos or having their cultural language.
Thank you, Daniel. I'll move on to the next question. It's from Ewan Mason. He's curious to know what this framework does that the national standards doesn't already do. What was the thinking behind developing something new?
I'm happy to pick that up, Vic. I guess the national standards are there to provide a bit of a foundation and a bit of a platform. So SCDC, the Scottish Community Development Centre, were part of the group developing the guidance document and also part of our group in developing the framework. So they've been a key partner to support us move that forward. I think what the national standards do is provide that platform. What we want to do on top of that platform is actually build a bit more of the expectation in terms of what's expected of an organisation beyond those those 7 key standards that are there. And I think it's also about how they go about doing that, to be able to turn around to their own governance structures or meet their statutory duties in terms of have they done it or not. I think the standards provide the platform, but they don't close that down in terms of actually trying to offer the next step with some of that stuff. So I think we're all kind of keen in terms of actually trying to develop that and move it forward in that way to give the organisations that tool to be able to do it. But again, it's also about using the tool as the improvement tool as well. So it's about supporting and developing practice, and how do you do that in an ongoing way? You know, how do you continually look to create that improvement cycle as you move through your work? You're on mute, Vic.
There's always one, isn't there? Got a question in from Hamish Kidd. Would be interested to hear thoughts about the digital divide that may exist for rural and remote communities and those with lack of internet access or digital skills. Support in this area can make a big difference.
I'll chip in here very quickly then. I think you've got a very, very valid point. I think for some people, digital engagement really suits them. We have to acknowledge that. And I think it's something that the guidance absolutely wants to reflect, particularly during the pandemic, post-pandemic, we have seen more and more engagement digitally. Here we are engaging digitally. So absolutely that has to be embraced. But I also accept that it doesn't suit everybody all of the time. Some people just don't have the basic tools, they don't have the basic knowledge. And again, that's something that we will reflect in the guidance. So thank you very much indeed for raising that. We're on it, as we say.
Thanks for that, Louise. There's so many more questions flooding into the chat box. I'm struggling to keep up with things, but I've got one here from Lucy Dorian. Creativity is mentioned in the guidance. I'd be interested in how creative, innovative approaches can be evaluated, captured and shared. What other areas of work can we tap into in terms of services like art, school, business, technology, etc. can help put the end user first and foremost? Is anyone who would like to pick that up? Daniel, silence is golden. I'm going to pass over to you.
I think I don't want to mention, but Lucy's part of my team there, so there's a lot of thought process going into some of that stuff. I wouldn't like to be the one that answers that. I think as we move forward with some of this work, we need to consider how we look at all aspects in terms of actually moving the work forward. Lucy's picking up a good point in terms of the creative aspect there. For me, it's an area that needs to be developed, I think, for us, how we move it forward. No hard and fast answers on that, but happy for any Scottish Government colleagues to share any thoughts.
Craig, you're looking thoughtful.
Thank you. I was just locating where in the document that word appears, and I think the thing that struck me was, and apologies for not remembering where or who said this, but it was thinking, and the word innovation appears after creativity, but it's again thinking about the boundaries and the constraints that sometimes we're too close to see, or we're frightened to challenge, or to really be emboldened and empowered to think up creative solutions for service configuration, or who provides a service, or which profession might provide a service, or how people with lived experiences might become involved. There's some wonderful work in mental health services in terms of peer support and learning from that. And so I think anything that, if I was being slightly challenging, I'd like to see more of a fusion and a connectedness with things like how it feels, creativity, than I would around self-evaluation, governance, audit, performance. And I get why that's important, particularly when there are statutory obligations, but we're in the space of the how, and that does give us the space to not be constrained by the things that we've all seen, which is, and colleagues have heard me say this already at least once this week, around this turning into a beautifully produced document which actually doesn't involve the people who make things happen, who are going through the particular issues at that point in time. So the more we can have creativity, and even just saying that word, you get a different emotional reaction, or certainly I do, than some of the other words that come along, like I put this in the chat, like frameworks and guidance. And so the more we can connect with that, I think the better outcomes that we'll be able to work together. We'll enjoy the work more, and the people that we serve might get different sorts of services in the future.
Thanks for that, Craig. Louise, I think you had your hand up for a wee while. Do you want to come in on that point?
Just very briefly, I think I mentioned in my section about the lived experience, and I think this is really the opportunity for the team who are helping to refresh and update the guidance, is to really listen to everyone's experiences. And if you have been particularly creative or innovative and you're proud and you want to share it, then please do, because that is one way that we will take that on board in order to be able to illustrate it to everybody else. I guess that comes down to qualitative as opposed to quantitative. So qualitative evaluation is so important. And yes, you're right, Craig. I think when you do hear the word creative, it does elicit a completely different emotion. And I keep going back to this, but the pandemic really has brought out the very best in many people in terms of creativity and original thinking. So let's capture that. Let's all keep talking and sharing the ways that we are doing it, because who knows what we may be able to develop from this point forward. I'm very positive.
Thanks for that, Louise. Got another question from Diane Graham. There appears to be quite a varied picture around resources to support community engagement in organisations across Scotland. Is there a bit of influencing or work to be done around raising the priority? Sorry, things have just popped into my screen, so I couldn't see the rest of the question. Around investing in the skills and knowledge within organisations to support both this process and also the engagement itself. Daniel?
Yeah, I'm happy for our Scottish Government colleagues to come in on it, but just it's something that I'm quite passionate about as well, and it's a really good point by Diane. That resource was something that was actually brought up with the working group, and there was an insistence from one of the public partners that was supporting the working group to detail that requirement or that importance for resource as part of that guidance document. And the public partner was really pleased that it was maintained within the final version of the document. The pictures, as Diane says, really varied in terms of what's provided as resources right across each of the organisations that be looking to deliver engagement activity. From my perspective, it's really keen that we understand where that starting point is for each organisation, because we don't want to set them up to fail, and it's about development and developing practice and increasing capacity. But equally, the message I think within the guidance is that, you know, in part it's the organisation's responsibility to be delivering this work. So it's not simply about having an officer that does this work or somebody there. It's about weaving it more through the culture of the organisation as well. So a bit of a kind of two-pronged approach for the organisation to understand that it needs to be a collective approach, but also being realistic in terms of resource and capacity to do that.
Craig, you wanted to come in on that point?
Yeah, so it was just in response to Diane's question. So the simple answer to our question as phrased is yes. The document itself includes the statement: leaders must commit the necessary resources and people, time and money. And for me, there's something around. So from an NHS perspective, all NHS board accountable officers have a duty of quality, but if you know where to look, they also have a duty of public engagement. And sometimes in certain fora and discussions, I've reminded chief executives around that duty of public engagement, around conversations around, well, what are the people, time, resources, skills, knowledge, arrangements within your board that are continuously improving and resourcing and nourishing that duty that you have and refreshing it, whether it's after a pandemic or because of a unique local situation. So for me, there is something about, and it goes back to what we said earlier about starting the conversation over the next year with people who make decisions about resourcing, about training, about skills, and so that we can actually have those conversations around, do you have the resources that you need? If yes, how do you know they're making a difference? If not, what might you get? How we connect you with other resources within the communities that you serve, and thinking creatively around what a resource is. And they might not have it in their budget line, but it could be that people that they're in meetings with every day have got some resource or skill or knowledge, so I think it's continuously about making those connections and being just as creative with resources, whether they be existing ones or new ones, as we are about some of the other things we're talking about.
Thank you for that, Craig. And I think we've got time left for one more question. And Christine Jess has got her hand up. Christine, do you want to come in?
It wasn't really just so much a question, it was a follow-up on what's just been said, because I was that public partner who banged on about the need for resources for quality engagement. And the reason I wanted to come in was really just to emphasise there was excellent participation in the meetings that helped to develop the framework, and all views were listened to very, very carefully. So I just wanted everybody else on this Teams meeting to know that we had a voice as members of the public, and that the group that were tasked with drawing this together very much acknowledged that and took that on board. And I think that's an example of very good practice as well. So it was just by way of compliment to the work that was carried out.
That's lovely to hear. Thank you, Christine. And I think that's us done for now. There's been lots of comments and questions that we haven't had a chance to get to, so apologies if your question hasn't been answered, but we will go through all the comments and respond where we can. And I'll pass back to you now, Daniel.
Thanks very much. And Christine, apologies, I didn't realise you were on the call, so it's great that you were, and it was great that you were able to come back in. So excellent and good to hear from you. Thanks very much, everyone, for your participation and attendance today. It's been really, really good. I think from my own perspective, I'd be keen to kind of go through all the comments, thoughts, considerations that have been raised here to look to see how we move these forward. And I know my colleagues at Scottish Government will be keen to do the same. This has been good for us in terms of moving some of the discussion forward, but it is a live discussion for us. We're very keen to keep the discussions going. From my perspective, in terms of the quality framework, very keen if people are interested to get in touch. You also have the details. Louise has obviously made that offer in terms of actually carrying on the discussion around guidance. You also have the details for that if you want to do that within the chat box, but I'm sure we can also send out communications to you after the session. So I'm sure Louise won't mind me saying please get in touch with her as well. Thanks again for everyone. Wondering if there's any comments from any of my Scottish Government colleagues want to come in and any final points at all?
If it, just from me briefly, I put it in the chat. I mean, I hugely enjoyed listening to and reflecting on the issues, and again, we should explore whether colleagues on the call today. I notice we've got, I think, over 100 colleagues on the call. We should maybe look at whether further opportunities like this, maybe to explore and get creative with particular challenges on the how. We should maybe look at continuing to do that as part of the work. But I know Louise and the team and Daniel and colleagues are all discussing this. But thanks, everyone.
Fantastic. Thank you. And just as a final plug for the next webinar session that we have, next month we have a webinar on community engagement in primary care. And details of that will be available to you and will be probably sent out to you as well. So please feel free to join that one if you can. Final point, thank you very much for everybody's attendance. I hope you all have a lovely rest of the day for Wednesday and enjoy the rest of your week. Thank you.
Thank you. Bye-bye.